Hello, my name is Susan, and today I'm going to be assessing your heart and your lung sounds. I'm going to start by assessing your heart. I'm going to listen in many areas and may have my stethoscope in place for longer periods of time. This is nothing to worry about. I'm just making sure that I hear accurately.
Okay.
I'm going to start by listening to the aortic valve. You can breathe with your mouth open, just nice, normal, regular breaths. I'm going to listen to the pulmonic valve. Erb's point. The tricuspid. And the mitral valve. I'm noting the rate and rhythm, and I'm identifying S1 and S2. I'm also listening for any abnormal heart sounds, which would include S3 and S4. I'm listening for any murmurs, and I'm not limiting myself to those places. I'm expanding my range. I'm going to assess the same points with the bell of my stethoscope. Listening for murmurs, or any abnormal sounds. At this point, I would have the patient lay on their left side, and I would listen with the bell of my stethoscope at the apex of their heart for the presence of abnormal sounds. If I could have you lean slightly forward for me. I'm going to now listen at the base of the heart on the left and the right side to check for any murmurs. And an exhale for me, please. And once more. Thank you. I am now going to listen to the breath sounds. I'm going to assess for bronchial breath sounds, bronchovesicular breath sounds, and vesicular breath sounds. I'm going to listen to the breath sounds equally on each side, noting any abnormalities. And if you could take a deep breath for me and exhale through your mouth. And again. Good. Making sure that of noting any adventitious breath sounds during my assessment. I'm now going to assess the breath sounds posteriorly. I'm going to move my camera. Deep breath for me. Thank you.